You're petting your dog and you notice a dusting of white flakes caught in their fur. The immediate instinct is to assume they have a simple case of dry skin, head to the local pet store, and grab a generic moisturizing shampoo off the shelf. But applying an unguided, arbitrary treatment to your dog's coat often backfires. By adding extra moisture or oils to the wrong kind of skin condition, you can easily find your dog in worse shape a week later, scratching intensely, sporting a greasy coat, and emitting a foul odor. Those flakes are actually a clinical condition called seborrhea. It indicates a defect in the skin's keratinization process. Instead of shedding normally, the skin cells are turning over and dying too rapidly, clumping together into the visible scales you see on the surface. And those flakes are an alarm bell for radically different biological problems. To figure out why the skin behaves this way, veterinarians run symptoms through a diagnostic funnel, separating potential root causes into 3 main investigative buckets: invaders, internals, and genetics. Eliminating flakes permanently requires shifting focus away from the surface symptom and toward the specific biological pathway driving it. The first diagnostic bucket targets the invaders. These are the microscopic parasites and organisms that actively feed on the dog's skin. We start with a mite called Cheyletiella. A Cheyletiella infestation produces walking dandruff. These are microscopic mites physically creeping across the skin surface, carrying dead skin cells on their backs as they move through the hair follicles. They also carry a direct zoonotic risk. This means they can jump from the dog to you. In about 20% of cases, human owners end up with highly itchy, crusted red bumps grouped along their arms and torso. If the scrape is clear of mites, the next invader on the list is a yeast called Malassezia. This fungus is actually a normal, everyday inhabitant of healthy canine skin. Malassezia is entirely lipid-dependent. Its survival relies strictly on feeding off the natural oils, or lipids, produced by your dog's skin. This chart illustrates exactly how that biological dependency works. When a dog's skin lipid levels rise and the coat becomes too oily, the Malassezia yeast has an unlimited food supply. The population explodes. This overgrowth triggers a severe inflammatory response, resulting in thick keratosebaceous scales, a greasy, waxy material, along with traumatic hair loss and a distinctly malodorous smell. These surface invaders turn your dog's skin into a microscopic feeding ground. You cannot resolve these infestations with a generic moisturizing soap. You have to deploy specific parasiticides or antifungal agents. If the skin is completely clear of invaders, the diagnostic funnel shifts to the second bucket, secondary seborrhea. This is the most common cause of dandruff, occurring when the dog's internal physiological systems malfunction. The 2 primary culprits here are environmental allergies and endocrinopathies. Endocrinopathies are severe hormonal imbalances, like hypothyroidism or Cushing's disease. When a dog lacks vital thyroid hormones or suffers from severe allergic inflammation, it destroys the skin's protective barrier from the inside out. The cellular structure literally breaks down, completely losing its ability to retain moisture. The immediate consequence is excessive, visible scaling. Even worse, this broken, dried-out barrier leaves the dog's skin wide open to secondary bacterial infections, a condition known as pyoderma. If an internal malfunction is the cause, topical shampoos are completely useless on their own. You have to put out the underlying hormonal or allergic fire systemically with oral medications before the skin can heal. Only after every parasite, yeast, and internal disease has been ruled out do we reach the bottom of the diagnostic funnel, primary idiopathic seborrhea. This is a hereditary defect in the skin's regeneration process. It's an inherited genetic flaw hardwired into the DNA of specific breeds. Cocker Spaniels are a prime example of a breed heavily predisposed to this mutation. Basset Hounds are also frequent carriers of this genetic flaw. Their deep facial folds create the perfect environment for seborrhea complications to thrive. Because this faulty epidermal turnover is coded into their genetics, there is no cure. It is a lifelong condition, producing either chronic dry flakes or excessive grease that demands permanent, targeted topical management. Because the root causes of seborrhea are so radically different, the medical treatments range wildly. A mite infestation requires sulfur-based dips, while a yeast overgrowth responds best to a rigid schedule of 2% myconazole and chlorhexidine baths. Primary genetic seborrhea requires highly precise chemical management. Vets use cherolytic shampoos to actively slough off dead cells, or cheroplastic shampoos to slow down cell reproduction, relying on potent active ingredients like benzoyl peroxide or salicylic acid. This comparison shows why guessing is dangerous. If you mistakenly apply strong benzoyl peroxide shampoo to mild, dry scaling, you will severely damage the skin barrier. The chemical strips away healthy layers, leaving the skin raw and exposed. This is why clinical testing is a mandatory first step. A veterinarian must perform tape strip sampling, skin scrapes, and blood work to isolate the specific biological driver before a single drop of medication touches the dog. True relief for a dog's dandruff doesn't come from a beautifully marketed, sweet-smelling bottle at the pet store. It comes from precisely matching the medical treatment to the biological root cause.